No, payment is not at all a limitation because thanks to our administrative direction in the hospital, they really tried to keep it very, very small amount, which is only 20 euro for 20, 30 minutes of therapeutic patient education. So patients have no problem to pay this amount because it is small. It's handled by two persons, the dermatologist and the nurse, and the dermatologist asks about the information they got in the first consultation, what they know, what they read on Google and so on, or by the other dermatologists consulted. And then they try to reinforce what is good and to correct what is wrong, at least in our opinion. And then the nurse explain and show to the parents or in the patient, the skin of the patients, or if he doesn't have all the clinical manifestations, they show pictures. And the nurse explain that each type of skin feature should have a specific treatment. And then the nurse start to do it, showing and explaining to the parents how it should be done. And the last part of the dressing is usually done by the parents under the vision of the dermatologist and the nurse to check if they perceived all the information necessary. Of course, if the child is aged a little bit to understand, we try to involve the child, which is very, very important, to let him understand why it should be done in order to improve the compliance also of the child. And we insist also to consider the dressing as a moment to talk, to play or to talk, depending on the age of the child, between parents and the child, and not a punishment for both. So otherwise compliance will be less for both.